Well, in this week's Cardiology Countdown, we'll cover 3 organs: the kidney, the brain, and the heart. Beginning with the number 3 spot is a meta-analysis of the effect of intensive glycemic control over time on renal outcomes, and in particular on albuminuria. And this meta-analysis in the archives looked at 7 studies, 160,000 patients randomized, and found a decrease in albuminuria, but little else, and so no difference had been seen previously or in this analysis of development of end-stage renal disease or a doubling of creatinine. And so while there is an apparent effect on reducing albuminuria, the more important endpoints, and notably cardiovascular events also in other analyses, really don't add support at this point to intensive glycemic control. At the number 2 spot is a paper this past week in The Lancet that looked at thrombolysis for stroke, expanding the time window and the age categories. And this was a very large study, the 3rd international stroke trial that involved 3,000 patients. It's known that thrombolysis for patients under the age of 80 presenting within 4.5 hours of the onset of stroke have a benefit of thrombolysis. And so they studied patients above the age of 80 and included those up to 6 hours. And so overall, they found a benefit in terms of the functional outcome using the Oxford Handicap Score of about 25% improvement. Overall, there was a higher rate of early intracranial hemorrhage and death, but by the end of 6 months, the mortality overall was similar, and so an early hazard that was improved with fewer deaths post that early hazard period. And thus expanding the age criteria and the time criteria for use of thrombolysis for acute stroke. And at the number 1 spot is the release of the 2012 ESC heart failure guidelines. This is a very nice comprehensive document that covers initial diagnosis, all of the modalities for risk stratification, has a whole section on acute heart failure, and sections devoted to systolic heart failure and heart failure with preserved ejection fraction. And then finally, new areas for research in this important area. And so I encourage you to look at the CardioSource summary of that and the full document. So for this week's Cardiology Countdown, I'm Chris Cannon.